Hey, welcome back to my channel. This is Nasu with Fight for Kidneys. Thank you for watching. Thank you for subscribing. Thank you for commenting. Thank you for sharing. And thank you for following me. Welcome again. Good morning, good afternoon, good evening, wherever you are watching from. Thank you for joining me again. Today, I'm here to talk to healthcare workers, doctors, nurses, nursing assistants, CMA, everybody in healthcare, lab techs, whatever you do and you are in healthcare. Today, I'm talking to you, encouraging you for us to go outside our comfort zone and talk about kidney health and bring that awareness. Join us in this fight for kidney health and fighting for our kidneys. Before I start, and before I challenge you, always ask your why. All of us have a why. If you're a psych doctor, psych nurse, or if you work in psych, if you're a cardiac nurse, working or cardiac doctor, working cardiac, if you are an OBGYN or baby mother, if you're research, if you're in lab, checking those, analyzing those labs, wherever you are, you have your why you are there. But in all these areas of healthcare where we are, we have one common denominator. And one common denominator is the kidney. Kidney that we do not talk about. Kidneys that we do not bring awareness. Kidneys that we say just a little bit about it. So let me give you a story. And I said this probably in my first channel when I introduced my first video, when I introduced myself. I went to Kenya and I was about to graduate in nursing school. And I was just doing my own business. And I met this lady, a close friend to my sister, who was going through dialysis. And she was like, so we were like, what are you doing here? And she's like, I'm here for dialysis. And I'm like, what's dialysis? Mind you, I was graduating from nursing school. And we talked in lengthy, and she explained to me why, what really she has to go through. And she asked me about a machine. I'm like, what kind of a machine? And when I came back, because I always wanted to be an OR nurse, but that day changed my reason, my why. I didn't know why. My why to be an OR nurse was because I thought it was cool. I thought, oh, I work in OR, I'm an OR, we operate on people. That was my why, probably why I wanted to be an OR nurse. Everybody has a why. But that day that I met that lady, she changed my why. And I've worked hard. I did all the research I could to learn about kidney disease, learn about kidney health, and the impact that it have on people's lives. And when I came back, before I graduated, I told my instructor that I will be working. I need to know more about kidney health, and I want to work in dialysis. I thought about dialysis. I bought all the books that I could read to learn about dialysis. And that's why my why is because I felt I can make a greater change in somebody's life. And every day I go, no matter how stressful it is, because most of you guys, especially those ones who are not in renal care, they say, I do not want to do that. It's the most stressful job. It is, but the most rewarding. To me, it's the most rewarding job I have ever done. I enjoy every day, even when I'm stressful, I strive to go to work and make a difference in those people's lives. So today, I'm not here to talk about myself and why I care so much about dialysis and why I care so much about renal. But the reason I'm here is to invite all of you guys, whoever in healthcare, whichever area in healthcare, we can change. We can change the narrative. We can change the trend. The numbers are going up every day. Every day you look aloud, the numbers are going up for people suffering from kidney health, people suffering from kidney disease, people needing dialysis. And mind you, even if it doesn't affect you, somehow, especially in this country, it's affecting you. Your tax money is paying for those services. But we can change it. We can change it by bringing that awareness. Bringing awareness. And one thing I always tell my team and the people that I work with, today we might not know somebody who is going through kidney disease. We might not know a loved one or a close person. The people we might know is the people that we are taking care of. But in the next 5 years, we'll know somebody, unfortunately, we'll know somebody who is so close to us. And because we work in this care, because we have seen it, we'll help those people go through, be able to thrive, be able to live a normal life, despite them going through dialysis. That's why I'm challenging you. We are coming to times of holidays, Thanksgiving, New Year, Thanksgiving, Christmas, New Year. It's a time where families meet. They get together, they eat, and they celebrate. Fortunately enough, this year we might not even talk about COVID. We might not even talk about politics. But what can we talk about? One thing we can talk about this year, or these holidays, or this holiday, whichever one you go to, or whichever one you celebrate, we can talk about kidney health. You can ask your loved one, do you know about kidney health? Do you know your blood pressures? Do you know your blood sugar? And just asking that question, they might say, hey, who do you think you are? But let me tell you, down the road, they'll come and thank you and say, hey, thank you for bringing up that question about kidney health, about our blood pressure, our blood sugar. I also need to remind you why I always talk about it. And this is so dear to me. I remember one time I was talking, and I also discussed it in my first channel. My first video. I was talking to this nurse. We were two nurses. And then another nurse happened to come and had our conversation. So we were talking about where was this nurse? I had not seen her for a few days. And I was like, where are you? And she said, oh, I went for mammogram. And then this other, I said, oh, good. How did they go? And she was like, it's okay. It was okay. Then this nurse happened to come in, and she's like, I've never gone for mammogram. And the day she went, she found out she had breast cancer. So if I didn't ask, this is what I say, if I didn't ask, or if I didn't say something, I didn't bring it up, asking this nurse where she was, then this nurse could not have heard about it and say, oops, I have not gone for mammogram. I'm about that age, and I should have had a mammogram done. So that's why I'm always come here and ask you guys, let's probe those questions. Let's be there to advocate for our kidneys, because they can fight for them, but we can fight for our kidneys by asking those questions, by asking people, do you know your kidney health? Do you know your blood pressure? Do you know your blood sugar? What are your blood pressure status? Do you know your normal blood pressure? Do you know your normal blood sugar? We fought for HIV. I remember when HIV came, or it was discovered, or it was found this disease about HIV, everybody, even in the deep of the villages in Kenya, where I grew up, we all knew at a tender age, there's something about HIV, because there was so much fight about HIV. So much fight about HIV that everybody you spoke about, they're like, okay, protect yourself, protect yourself. There was signs everywhere saying, okay, we gotta protect ourselves, we gotta protect yourself, we have to make sure, we need to know our status. And then what happened to COVID? Everywhere, all over the world, we were united and we became one with COVID. And we all sang the same song because it affected all of us. And now, kidney health, kidney disease. It's affecting so many of us, and we are still not talking about it. We are not still saying anything about it. So I'm calling us healthcare workers. Let us all unite. As much as we say it's stressful, as much as we feel the patients who go through dialysis, they are stressful, put yourself in their shoes and feel, just put yourself in their shoes and see how it feels to go to dialysis 3 times a week, getting needles put in your arm, trusting that person to put a needle in your arm. But we can fight, we can bring awareness so that somebody that you care so much about will not go through that. Oh, we can slow the progression of kidney health. And how can we really slow the progression? We can only slow the progression by talking about it. In our meetings, in our break times. Even when you go to games, let people say you're nagging, but talk about it. In your social media, we know how powerful social media is. Talk about it. Just say something about kidney health. That's all I'm asking people. Let us fight for kidney health. Let us fight for our kidneys, and let us bring awareness, because it's costly, it's expensive, and nobody want to go through that. You don't want to be the person going through kidney disease. You don't want to be that person going through dialysis. And you don't want to be that person experiencing that from a loved one. And we can help. We can change the narrative by bringing awareness. Just tell one person, hey, you have changed the world. And that person tell another person, we have still changed the world. We have changed the narrative for kidney health. Today, that's all I want to say. These holidays, as we prepare for Thanksgiving, Christmas, and New Year, as we shop, also let's shop the information about kidney health. And let's talk to our loved one and the people that we care about kidney health and the things that they can do to prevent their kidneys, to keep their kidneys healthy. I really appreciate you guys. Thank you so much. And till next time, thank you. Bye.